Hi there and welcome back to the channel. Today I want to talk about the sensitive topic of health tourism in Portugal. Now, most people who live in Portugal, and certainly most Portuguese citizens who live here, will be acutely aware of the pressures that the National Health Service here, the SNS, is currently facing. It's quite common in Portugal at the moment to wait for about a month to get a doctor's appointment with your family doctor, if you can even get a family doctor, because basically I think at the end of last year 29% of people didn't have a family doctor, and there are massive delays in A&E, urgent treatment departments, routine wait times of 10 to 12 hours, and of course long waiting lists to be able to get surgical treatment. Now, this is not a situation which is unique to Portugal. It also happens in the UK. I'm familiar with that. And I think that it's because both of the countries share this idea that healthcare should be freely available to everyone, and if people are in need, then they should be treated. And this idea of free universal healthcare obviously is deeply rooted both in the British psychology and the Portuguese psychology, so I completely understand it. In the UK, for example, the NHS is practically a religion. And at the core of it is the idea that everybody who needs to be treated should be treated. Now, I think that historically that was people who are citizens of the country, who grew up in the country, who are working in the country and are making contributions through their national insurance or their social security contributions or whatever to the country, and of course through taxes of various forms, are entitled to this, and of course their offspring and people who've retired are also entitled to it. And that's all well and good. It's fantastic. However, when it comes to a situation where you're seeing large-scale immigration, particularly from the developing world, which we'll touch on later, and when you come to a situation where you have health tourists, who are people who are specifically coming to your country for a visit, for a few weeks or something, with receiving treatment in mind, and then subsequently disappearing, then I think it becomes a problem. Especially for a small country like Portugal that has limited resources and limited numbers of hospitals and doctors and nurses. I think that if the word gets out there that this is the place to come to get things for free and with a reasonably good quality of care, then definitely it can pose problems. And I think that that is what we are seeing right now. I actually read the article that you're seeing on your screen now, which is about excess deaths in Portugal. And it says that Portugal had the highest level of excess deaths in Europe at the beginning of 2024. And some people were trying to say that this was something to do with vaccinations against COVID-19. That's another kettle of fish. I don't want to get into it. But in the article, it actually indicates that it's because A&E wards are overwhelmed and people are having to wait for so long to be seen. That could be the cause. And I think that that is probably a much more viable explanation for the phenomenon. I also read an article in which the Minister of Health in Portugal, Ana Paula Martins, commented that health tourism was a problem in Portugal that was costing hundreds of millions of euros per year for the SNS, and that's obviously quite a lot of money in a small country like Portugal that could be put to much more productive use for the people who actually pay for it. And recently I watched an RTP report. Unfortunately, it's all in Portuguese, but I will link to the video below, which basically interviewed a number of healthcare professionals, and they outlined the kind of experiences that they're having on a daily basis with people who are coming from foreign countries, essentially as health tourists to take advantage of the system. My honest opinion on this is that mass migration, particularly mass migration from the developing world, countries which are significantly poorer and have lower standards of healthcare, sanitation, education, if you have waves of migrants coming from those areas, such as, for example, Central Asia or Africa, and you have those people coming into Europe, then you're going to face significant problems because there are so many of them, and it's incompatible with a welfare state. You cannot have migration at such scale and be able to maintain social services as you did before for the native population of a European country such as Portugal. What you can have is you can have mass migration from poorer countries, but they receive no benefits. They receive no access to public services. This is something that the US basically did for more than a century with great success. However, what you cannot have is a situation where these people can come into a European country and basically establish themselves very, very easily and instantaneously have access to the healthcare system, the education system, etc., because it just places immense pressures on those systems. Talking specifically about healthcare, you have to remember that a lot of people who are coming from the developing world bring with them diseases and conditions, many of which are incurable, for example HIV, which are far, far more common in places like Africa or Central Asia than they are in Europe. And the burden for the treatment of those conditions then falls upon the European healthcare system and ultimately the European, or in this case, the Portuguese taxpayer. Tuberculosis is an extremely serious condition and it's very, very prevalent in Africa and parts of Asia. HIV is an enormous concern, particularly in Africa. In fact, those very African countries where a lot of immigration into Portugal is coming from, places like Angola and Mozambique, where around 11.5% of the adult population of these countries are actually infected with HIV/AIDS. Thinking about a person in Africa or India with HIV, remaining there is essentially a death sentence because the medication is so expensive that it's basically out of the reach of most people. So the easier solution would be to move to somewhere where you can get treatment. So, if someone's a 25-year-old guy and they've been diagnosed with HIV in Angola, they can choose to stay in Angola and basically they may have another 10 years or so and the end won't be nice. Or they can move to Europe where they can receive treatment for this condition and they can live a relatively normal lifespan. What would you choose? Now, on the individual level, obviously I have sympathy for these people who are sick. But thinking about it from the perspective of maintaining a national health service, it should be absolutely apparent to everybody that we cannot just allow people to migrate pretty much freely or illegally into countries in many cases and then take advantage of the healthcare system like this. It's just not going to be sustainable for anyone in the long term. Looking specifically at medical tourism and the RTP report in particular, the doctors there were highlighting that they're seeing quite a lot of cases of pregnancies, pregnant women coming into Portugal to deliver their children, or people coming in with renal failure and requiring a transplant or some kind of expensive procedure such as that. It was actually pointed out that the people who are just coming in and basically playing the game, they're not so much immigrants, they're just health tourists. These guys were coming in mainly from Asian countries, and specifically Nepal, Azerbaijan and Afghanistan were mentioned. And the doctors gave the impression that this seemed to be an organised activity. And I can definitely say from my experience of living in China that it probably is. There are companies and organisations in Asia that are set up with the specific purpose of exploiting any kind of loophole in the system to get benefit for themselves. And this sadly is the case. And these kind of agencies, because they're normally agents, are allowed to thrive in those countries. They basically ply their trade without hindrance from the authorities, and they will go out and look for people who are unwell. They will maybe advertise online or contact them through social networks or whatever, and they will recruit them to pay something to the agency, and then the agency will arrange for them to go to a destination country, usually in the EU, receive treatment, and then fly back without paying for it. Because unfortunately in many European healthcare systems, the way it's set up is that the priority is on delivering the treatment, avoiding harm to the patient. If someone is sick, they need to be helped. So these people will receive the treatment that they require. They'll get the medication or they'll have the operation or whatever, and then technically they're supposed to pay. Now, in both the UK and Portugal, there's just this idea of paying for healthcare is, something that most people find disgusting. So there just generally isn't the administrative capacity of hospitals to accept payments. It's not well set up, to give people bills and to pursue them if they haven't paid and things like that. And if these people have just come into Portugal, for example, received their healthcare and then flown back to Nepal or gone back to Afghanistan or even gone to a third country, because many of them might want to do that as well, you're never going to find them, and there's no recourse. There's no opportunity to pursue a civil debt, in another country against somebody who has no realistic assets, and you probably wouldn't be able to find them or identify them anyway. It's just a hopeless case. And of course the agents know this, and they exploit this. They take advantage of the naivety of people who are running the Portuguese health system. And, Portugal is a high trust society because it's a Western society. People believe that, you're going to do the right thing in most cases because that's what would usually happen. People pay their bills. In general, anyway. But in Asia, there's a different kind of mentality, and it's also something that you find in Africa. I lived in Thailand for a long time, I lived in China for a very long time, and I've traveled a lot throughout Asia. I haven't spent so much time in Africa, but I have been there and talked to people. And I think that what needs to be appreciated here is that there's a completely different mentality towards taking advantage than there is in Western countries. Basically what I mean by this is that there are many people in Asia, for example in Thailand, in China, in India, and definitely in Africa, who basically feel that they are owed. That the West, that the white people kind of owe them for some perceived historical injustices. I don't want to delve into all of that. And it's quite bizarre, but that's the way that they think. For example, in China or Thailand, if a Chinese person or a Thai person cheated another Thai or cheated another Chinese, that would be regarded as bad. But if they treated a foreigner, then the foreigner would be regarded as stupid, and that would be fair enough, basically. And it's the same way in Africa. There is this kind of idea of being owed something or a kind of revenge or something like that. I don't exactly know how to best describe it, but definitely there are quite a lot of people from these countries who have absolutely no remorse about basically going to a Western country, taking full advantage of the system, getting expensive treatment, and then disappearing and leaving other people to pay the bill. Zero remorse. They just think that they're smart and we're stupid for creating this opportunity, which obviously smart people like them are going to take advantage of. And hey, maybe they're right. Another dimension of this problem is something in the way that many Europeans think, especially, middle-class Europeans. They have a lot of guilt. I don't know why they have it. I don't have it, not at all. But many people seem to think that we wronged the world, or we owe it to the world to try to solve this problem or that problem, or to make this situation right. I mean, you hear all the time, everything from Palestine to the latest natural disaster that's happened in Africa. In some way, we should do something, we should send aid, we should repair this situation. And often it's linked back to some perceived historical injustice that European powers have been involved in. Obviously, Portugal is a country with a colonial past, as is the UK, and I think to some extent that kind of idea may exist here. I really don't know. I don't think it's a healthy idea to have in a society, the idea that you have some kind of original sin because you happen to be a white European from a country with a colonial past. And therefore, you really shouldn't say anything when all of these other people from other countries come over here and start taking advantage of the social welfare system and pushing up your taxes and causing delays in hospitals. You really shouldn't say anything. Well, in my opinion, we really should say something. I think it's an atrocious situation that phenomenon like health tourism are permitted to continue, and I hope that there is an urgent and severe clampdown on this. It's something that Portugal and other European countries need to act on at a national level, but also at a bilateral level or multilateral level with the countries where these agencies and organisations are operating, because it really is done like a business. Addressing immigration more generally, both legal and illegal immigration into Portugal, because until very recently it was very, very easy to be a legal immigrant into Portugal. Basically, the door was open. Gladly, the current government has closed down the manifestation of interest route, which will over time help to improve the situation with the number of people who are coming here. But even with legal immigration, if it's coming from less developed countries where people have a lot more health problems, they don't receive immunizations, they don't have particularly good levels of education, they don't have particularly good levels of nutrition, both in childhood, in their adolescence and in their adulthood, and they come to Portugal, then it's highly likely that those people are going to have more health problems compared to, the baseline Portuguese person. And I also don't really accept the argument that when immigrants come here, they make a contribution to the social security payments through what they earn. The reality is that most of them earn precious little. They're working often minimum wage jobs, and the levels of their contributions probably don't even come close to matching the amount that they take out of the system in other ways. Is it realistically the case that someone who's earning minimum wage is going to pay more into the system than they're going to take out in terms of healthcare and education and public transport subsidies and all the other things that the government provides? I think it's highly unlikely. And I think that it is reasonable to perceive this as a burden on the country, because that's what it is. I mean, if you have a lot of low-end immigration, illegal immigration, or health tourism, then you're basically going to ruin most of the social services in your country, particularly the healthcare system in the case of health tourism. Alright, well today I wanted to make this video just to address my thoughts on the RTP report and the articles that I read. I think that this is an issue of pressing concern in Portugal and beyond Portugal in other European countries as well. We simply cannot allow immigration to ruin our healthcare system or our social services system, and especially we cannot allow medical tourism from the developing world to have such a deleterious effect on the healthcare system in Portugal or indeed in Europe more broadly. I think that the time for urgent action is upon us, and in fact we're well beyond the point where we should have been taking actions to reverse this. In my view, it's actually shameful that the government are allowing this to happen, and the sooner they put a stop to it, the better. So that'll do it for this video. I hope people found the content useful and informative, and I'll see you soon in the next one.